Dear colleagues, I'm Markus Trölsch. I'm dentist, physician, and oral and maxillofacial surgeon from Ansbach, Germany. During the COVID-19 crisis, the question for proper protective equipment was everywhere around us, so we decided to make a quick video guide to review the literature with you, what we have available. Dentists and physicians and their respective teams are at high risk of coming close to patients. We cannot keep social distancing. And as we know, it's sure that Sars-CoV-2 is transmitted via droplets while speaking, coughing, or sneezing. We are in the danger zone. For dentists, even more, as dental spray is around us quite frequently, and this might be an additional health hazard. The insecurity has been so high that some dentists even went so far to claim themselves as being super spreaders of the virus, which is of course not true. Now let's look into the literature. We know that this disease, COVID-19, is spread via droplets and that it needs the mucous membranes, especially of the oral cavity and the nose, maybe even the eyes, to enter the body and cause an infection. Now, another question that was around us a lot is, when do we use N95, KN95? What is it about them? So these are special filtering pieces for the face that are classified, especially in lab setting, as protecting the one who wears them, especially well from small particles, for instance, viruses. Now, the surgical mouthpiece, three-layered mouthpiece or mouth masks were not especially designed to protect the one who wears them, but were designed to protect the patient from the doctor. However, how efficient are our standard masks in protecting ourselves? And there's quite some literature about there, especially when it comes to influenza. And we can see that the authors of this study were true prophets, as they already stated in 2009 that N95 respirators might be in short supply during a pandemic. And furthermore, they showed that they didn't see any clinical relevance whether the healthcare workers were wearing surgical masks, three-layered ones, or N95 protectors. There's more evidence on this. This is from the year 2019, and this study comes to the same conclusion, which is especially interesting as they were already checking for coronaviruses. And they were pretty sure in their summary, on a clinical basis, there's no difference between surgical masks and N95 protectors. Here comes the Holy Grail, here comes Nature Medicine from the spring in 2020, looking into the virus shedding in face masks, like surgical masks, three-layered ones, and they found that they protect fairly well against coronaviruses, especially when it comes to the wearer, but also the surroundings. So it protects both parts of the interaction. Interesting in this study is that our surgical masks are not that good actually against influenza viruses, as you can see in blue here. So very important, if N95 masks are in use, these valves are actually not filtering the exhalation air, and thus only the wearer is protected and not the patient, which is a very important thing to consider. Furthermore, there have been rumors that the prolonged use of N95 masks for days, weeks, and maybe months might actually be hazardous to those who wear it. This is from Switzerland, a study or a information paper of the Swiss dental organization that came to that conclusion. And there's actually quite some evidence out there. For instance, this study that showed it, and in another study demonstrated that our valves in these N95s really don't have any benefit for the one who wears it. Now, to facilitate the use of surgical masks in medical and dental facilities, we provided a guide to teach your team how to really work with them. You can download that from our webpage. And furthermore, we designed a guide for patients so that patients are actually instructed in areas of the world where it's mandatory to use them right now, how to use the masks properly. For us, in a dental and oral maxillofacial surgery setting, we're close to the oral cavity all the time. This is how I treat patients all the time. Our offices were open during the pandemic, so you can see surgical mask, goggles, cap. That's standard. Even if I talk to a patient, I will not remove that at all. Furthermore, if we have any procedures that that produce splatter or aerosols, we will wear disposable gowns and disposable caps, and of course gloves always. And this is the setup for COVID-19 patients or suspects. You see a face shield here. We only use the face shield in these circumstances as our goggles don't fit properly anymore. So allow me to summarize. Our normal surgical masks seem to be okay in protecting us on a regular, everyday, today setting. The N95s show better protection in lab settings, and that's why we use them for suspects or for COVID-19 patients. They might have their downsides as well. Our standard equipment for just any contact, even just talking to a patient, is mask, cap, gloves, goggles. And it's also important for you to regard, of course, your local regulations. With that, I thank you for your kind attention, and this is the email address you can direct questions to if you wish. Thank you.